Perhaps the first thing that we have to do is define conscience, because I think it's often misunderstood. You know, conscience, if I were to define it in a few words, I would think of the words of St. Paul in the Epistle to the Romans, where he talks about the Gentiles that did not have the law and yet had the law written in their hearts. And when we look at human societies of all times, in all places, conscience is a concept that existed everywhere. It's universal. Everywhere people have a clear sense that they have an understanding, innate, so to speak, in their heart that allows them to distinguish what is right from what is wrong. Conscience is under attack. This is not a new problem. In the 20th centuries, there were many societies where conscience was combated and where the notion that the state would bring conscience or would define right and wrong. And when the UN, after the atrocities of the Second World War, was first formed, one of the first things it did was to create the International Declaration of Human Rights. And the first of these human rights is the freedom of conscience. And if we think of our particular Canadian concept, the Canadian Charter of Human Rights and Freedoms has 4 fundamental freedoms. And the first of these 4 fundamental freedoms is freedom of conscience, distinguished from another fundamental freedom, which is freedom of religion. Those things were there so that people could never say, I didn't do anything wrong, I followed the law of my country. That, we learned in the 20th century, is not a true excuse. No, because there's a law written in your heart, and every man should know that you should not kill your neighbor, even if the laws of your country allow you or tell you to do so. The law written in your heart tells you you can't do that. And increasingly in Canada, we are facing a similar challenge. On one hand, that the killing of certain human beings in some circumstances may be okay. When the physician, who may not even be Christian, but in good conscience, cannot participate in an act that involves the killing of a patient, says, I cannot participate, I need to refrain from this. The French term for referral is recommandation, and certainly, that speaks clearly even to the English ear. Recommending a treatment for your patient, sending them somewhere for a treatment that you recommend, is obviously a form of endorsement. And if my patient asks me that in their state of mind, because of their suffering, they think that death may be the solution, my answer as a Christian cannot be, you are correct, death may be the solution. At the institutional level, I can't help but be reminded by these 2 medieval institutions that came to be. On one hand, the hospital, and on the other hand, the university, that have no other parallel in the world. And of course, that have given us the modern hospitals and universities, but that have very Christian roots. At the root of the hospital, our callings as society to look after the most frail, and at the center of the university, the essential knowledge that the world around us can be understood, that it's intelligible, that it's created with inherent logic. And why? Well, because it was created by Christ, the Word, the Logos. The same Christ who is also physician and healer and points us to help to others. And of course, medicine is a beautiful bridge where on one hand, we spend a whole lot of time in university and we seek to acquire higher knowledge, but all guided to the healing ministry and the service of the neighbor.